Hello, this is Mary Whalen with WWNA. We interrupt your daily programming of Days of Our Lives to shed light on a tragic epidemic that is happening across the nation. New evidence has been brought to light that our society has a very loose interpretation of what public health is and what it encompasses. I have here with me Taylor Rogers, one of our special reporters who uncovered this story. Taylor, tell us a little bit about what you learned.
Well, Mary, what I found was absolutely shocking. It seems that the youth of our country have no idea what public health is. I don't think they even know how to wash their hands.
That is absurd.
I couldn't agree more.
Well, Taylor, thank you for your time.
Thank you so much for having me.
Now, let us go to Aliana Latta, who uncovers this mystery.
My name is Aliana, and I'm here at the University of Evansville, where students are completely misinformed on what public health actually is. Our goal with this segment was to take what students thought public health is and compare it to what public health actually is. In addition to that, we wanted to uncover the different organizations that contribute to public health. Keeping that in mind, we also wanted to let students know across the nation what they can do individually to promote public health in their daily lives. First, we asked students what they think public health is.
Hello, Vasily.
Hello.
I was wondering, what do you think public health is?
Public health is, access to clean water, sanitation, things like that.
Thank you.
It means being healthy in public.
I don't know, the health of the public. I don't know, being public, I don't know, healthy, I don't know.
Making the public aware of a healthy lifestyle.
We are here reporting live with Jordan Carpenter. Jordan, what do you think public health is?
So public health is, I really think it's the ways that health care agencies, I don't know what they are specifically, but they put regulations on food, they put it on the FDA. They have cleanliness standards that they have. You go into hospitals and they have hand sanitizer dispensers everywhere. They're trying to stay clean.
Well, thank you.
Public health is the health of a community or a population. It could be one of a whole or just a subset that you're looking at.
The Big GEMS are a mnemonic device which summarizes the determinants of disease. They include behavior, infection, genetics, geography, environment, medical care, and socioeconomic status. The three core functions of public health are assessment, policy development, and assurance. They are further expanded into subcategories: monitoring health, diagnosing and investigating, informing, educating, and empowering, mobilizing community partnerships, developing policies, enforcing laws, providing care, assuring a competent workforce, and evaluating. These aspects are all brought together by research.
Next, we asked if they could name any public health agencies.
Oh, Jacob was not going
UNICEF?
Doctors Without Borders is a non-government public health organization. It is more commonly known as Medicines Sans Frontiers in 60 countries throughout the world. This organization provides medical aid where needed most, such as armed conflicts, epidemics, natural disaster, and other crisis situations. Not only do they have rapid response teams, but they also run long-term projects to tackle health crises. DWB also brings access to healthcare to everyone. Different high-quality care ranges from vaccinations, maternal and pediatric care, fighting neglected diseases, to complex surgery for the world's poorest people. The core purpose of Doctors Without Borders is to save lives and ease the suffering of people caught in crisis, allowing them to rebuild their lives and community. Their slogan is medical aid where it is needed most, independent, neutral, impartial.
The United Nations International Children's Emergency Fund is a global organization also known as UNICEF. It was created in December 1946 by the United Nations to help provide food, clothing, and health care to the children faced with the European famine. It is the world's leading advocate for children with a presence in 190 countries. UNICEF is supported completely on voluntary funds. UNICEF is involved with child protection and social inclusion
child survival, education, and gender equality. In 2013, UNICEF distributed $2.3 billion in supplies, with vaccines at the top of the list.
The Center for Disease Control, or the CDC, originally opened their doors July 1, 1946 in Atlanta. The CDC is the nation's premier health promotion, prevention, and preparedness agency and a global leader in public health. The CDC conducts critical science and provides health information that protects our nation against dangerous health threats and responds when they arise. This organization works on the national level and is comprised of researchers, scientists, doctors, nurses, economists, educators, and many other professionals.
The Indiana Home Health Agency is state-run. They have implemented the Healthy Indiana Plan, or HIP 2.0. The Healthy Indiana Plan is a health insurance program for qualified adults. It pays for medical costs for members and could even provide vision and dental coverage. It also rewards members for taking better care of their health. The plan covers Hoosiers ages 19 to 64 who meet specific income levels. The Indiana Home Health Agency also promotes getting vaccinated for the flu. They also work on tobacco prevention. The Tobacco Prevention and Cessation Commission exists to prevent and reduce the use of all tobacco products in Indiana and to protect citizens from exposure to tobacco smoke, such as change the cultural perception and social acceptability of tobacco use in Indiana, prevent initiation of tobacco use by Indiana youth, assist tobacco users in cessation, assist in reduction and protection from secondhand smoke, and support the enforcement of tobacco laws concerning the sale of tobacco to youth and the use of tobacco by youth.
Then we asked what the university does to promote public health.
There's this great thing that just happened. UE is now tobacco-free, which helps have cleaner air around campus, and it's great.
I think that they offer salads at Ridgeway, grilled chicken every single day. Jasmine's has, or Ace Place has apples.
They have like different fairs,
Mhm.
like that the nursing program puts on, or PT students. We have recently changed our smoking policy on campus,
Mhm.
so that's promoting public health. Downstairs, they try to make sure that you know the facts about the food that you're eating, so they're informing people about healthy living. The fitness center has a lot of good programs that they encourage people to participate in, and actually employees have a pretty decent health incentive program to make sure that they're exercising and doing annual screenings.
Finally, here are some things you can do in your daily life to promote public health.
Come on, do it the right way.
One thing I think I can do is, well, what I want to do is I want to go into Doctors Without Borders.
Okay.
And using neuroscience, well, not really, well, using my doctorate degree, I want to like promote like public health in third world countries
Okay.
and help public health related like medical diseases, you know? So that's what I want to do.
Also, big part of my major is sustainable policy, and a big part of sustainable policy is responsible agriculture, which tends to imply healthier agriculture, both in terms of consumption and lack of exposure to, toxicity, chemicals, pesticides, etc. Especially in this region, it's important because of the mercury and lead that we're all getting exposed to constantly through our food, let alone the neonicotinoids.
I think there's many things that a university can do. The university would obviously look at the whole entire campus, faculty as well as students, and then address the needs to each of those subsets of groups. Spreading awareness for things like bike injuries, helmets, using of different types of safety devices for everyday occurrences that may occur. Keeping a mind to the nature of the university as well as the amount of interactions people have with each other, I would think the university would promote healthy lifestyles, food and nutrition, activities, as well as try and control any type of communicable diseases, any type of flu, any type of medical issues that may also arise. On a campus, there are a lot of people that come in communication with each other, and things can spread very quickly. So I would hope that UE already has in place many of these initiatives and may consider further.
We hope this segment was informative and eye-opening, and maybe you will start to implement public health into your daily lives. I am Mary Whalen.
I'm Taylor Rogers
with WWNA. And now back to your daily programming.